So let's start the day. So we'd like to welcome Johannes Fisslinger, President of IMMA, to do the first talk with us this evening. Please put your, this evening, yeah. I'm still there last night. Please put your hands together for Johannes.
Good night. So that was the today. Good night. Have a nice dinner, and see you tomorrow. Okay. So good morning. Morning. Great to have you here. We start with something more organizational, basically just updating you about IMMA META Medicine Association and what's going on, some of the new developments, and Cora is going to tell you about the new handbook, the organ directory app actually, which is going to be available. You're going to love it. Next week actually, it's going to be available. But let's start from the beginning. So as you know, we started, Dr. Bada and myself, 10 years ago. So actually it's our 10th anniversary. Yeah. Whoa! Thinking about it. Wow. I'm not even that old. Shoot. Okay. And so we started 10 years ago, and we went through a lot of changes and shifts, and mostly, to keep up with things. And we are at a point right now where we just aligning a lot of things, readjusting, because we've been growing actually very nicely over the last years in terms of master trainers, trainers, and practitioners, and so we learned so much. And so I think part of what I like about our group is we are not stuck in one thing, but we go with the flow as we go along and grow it. And actually now is a time I feel that we learned a lot. We have a lot of amazing results, that our practitioners get. And now is the time to really go the next step, reach out to a bigger audience. And so a few things are needed for us to align that, which that's why you saw master trainers always like rushing. We don't have breaks right now. We don't have dinners because we're rushing always into our meetings and aligning ourselves and things like that. But just at the overview, so that's very, very clear for everyone. Meta health. Right? We have meta health, what we do, working with clients, diagnostically, therapeutically. The IMMA International Meta Medicine Association is kind of like our board certifying body. I call it the product control, the policing ourselves kind of organization. And at the very beginning, I felt like we need to do that because, as you know, in most countries, there's a tendency that the state comes in and says, we're going to check you guys out, right? And a lot of, like even yoga, for example, like in the US, the government, the states now want to regulate yoga, which is like, And so I said, let's do it from the very beginning. We police ourselves, we set our standards. Everybody that is part of Meta Health needs to follow the Code of Ethics standards. Who has read that, by the way? The Code of Ethics or the Code of Practice, which is on the IMMA website. So please do. And so we're setting our own standards, and that helps us to really grow into a professional organization, which we want. Because I feel like to really go that step and transform healthcare, we need to be professionals in everything we do. And so maybe that's a little challenge for everyone, to raise your own professionality in your own field. However you feel you can do that. I think that's all going to help us to really reach out to a much bigger audience. So we have IMMA, which is about accreditation, standards. It's kind of the connecting point of the international, worldwide, global network. And then we have obviously the master trainers. They have their own businesses, right? Meta Academy, university, Lars's company, all around the world. They have their own businesses basically to develop, to train, to reach out, to market, to reach a lot of new people. And then obviously we have the trainers and health professional levels, which I'll go into in a minute. Sorry, my slides didn't work today. My computer is totally down, but it's easy. It's very easy. In terms of the standards, that's the next thing I want to talk about, just to clarify that. So in the standards, we have the practitioner level, right? Which several years ago we modified that to have very clear standards, which is the 125-hour, 6-month training to the practitioner level, which I think most of you, everyone probably has achieved, right? Who's practitioner, mental health practitioner? Okay, good. And then the next step is the master practitioner. Well, let me step back a little bit. And again, also we kind of updating our training structures a lot right now. So you're going to see some adjustments, some changes over the next year. So the practitioner is really mostly about the analysis process, this 12-step process, and really integrating this new kind of thinking that we know mental health is. With a master practitioner, they're more in-depth training. We go more into the therapeutic aspects, how to work successfully with clients, how to create results. And then that's the master practitioner. And the specialist then is really becoming a specialist. And from my perception, that's really where we all want to go, right? Become specialists. And who feels mental health is something you can learn in the weekend? Okay. I agree. I think it's a great entry point, but to really become an expert, to become somebody really, that is confident and can really inspire people and create changes, I think we all kind of know it's something, it's ongoing. For me, it's been about 10, 15 years now, and I still feel like a beginner in many ways. And I think many of you also that are in for a long time, it's so deep, right? So much to learn, so much to grow for ourselves and our clients. So these are the basic levels, and as you said, please make sure you're on the IMMA email list. We do a lot of things over the next month, updating our websites. So more, and we're going to promote more our practitioner directories, trainer directories. So we reach out more to the public, so you have full practices. That's the goal, right? Another thing that we're planning to do, which you're going to hear probably next year, is starting a research project, which I think is important to do. So we validate some of the things that we know work, but bring it more into a traditional medicine format, where we have a research project. Then again, gives all of us much more credibility. So watch out for that too. Yeah, and I think that that's basically the big developments that are happening. Obviously, one of the big things that we worked on is this organ directory, because it's kind of the core of what we do, right? About the body-mind social connection.